discussion for World Mental Health Month. So very excited about the fantastic guests we've had, and great to see so many people joining us here today. As I said, please mute your microphones. Just a few housekeeping things. We will have opportunities for question and answers at the end. Please feel free to write questions in the chat box throughout the session and at the end, and when we get to the Q&A, that we will go through those and also have opportunities for people to put up their hands as well. So for those who don't know me, my name is Therese Fitzpatrick. I'm the global lead for the implementation of the UN System Workplace Mental Health and Wellbeing Strategy, which you were most likely know was launched just under about 18 months ago. And we've been looking at implementation for just over 12 months and looking at what are the priorities across the UN system. We know that there is all sorts of challenges within the UN system, but already also a lot of amazing work happening. So we thought today would be a good opportunity to hear from people outside the UN who've already done a lot of work in this area, where we can be learning a lot from what they've already done. And I'm sure they'll have lots of good ideas for us around what we can think about after this session and what we can think about in terms of implementing. So I won't waste too much more time introducing, because what I would like to do is to introduce our amazing presenters today. So we have Gordon Watson and Kathy Pike. So Gordon serves as the Chief Executive Officer of AXA Australia, where he's responsible for overseeing the group's operations in Japan, Korea, Hong Kong, China, Thailand, Indonesia, and the Philippines. Wow, that sounds huge, Gordon.
They're actually not all in Australia. It's okay.
I want to here and there. I still think Hong Kong is sort of in my part of the world. So he's a member of the group's management committee. He's a firm believer in the power of collaboration, diversity, and innovation to drive results and help others achieve success, a philosophy that has earned him a sterling reputation both in Asia and globally. So welcome, Gordon. So fantastic to have you here today.
Thank you, Therese. It's great to be here.
And looking forward to hearing around the collaboration, diversity and innovation, because I think that's really key for the work that the UN does, and certainly what we're really focusing on in implementing our mental health and wellbeing strategy. Secondly, I would like to introduce now, Kathy, you prefer to be called Kathy, if I got that right?
Sure.
Perfect. Yeah. So Kathy is a PhD. She's a professor of psychology at Columbia University Irving Medical Center. She serves as director of the Columbia WHO Center for Global Mental Health and chair of the faculty steering committee for the global mental health programs at Columbia. She's deputy director of the Health and Aging Policy Fellows Program. She's also senior supervising psychologist in the Centre for Eating Disorders at CUIMC. So welcome to you both. Amazing credentials and amazing experiences in this area. So we so appreciate you giving us the time today.
Glad to be here.
So I have some questions for both of you. I might start with you, Gordon. So I know at AXA Asia, you've built a reputation as a leader in mental health. What progress has it been made when it comes to workplace wellness compared to 10 years ago for you?
Well, thanks, Therese. Great to be here. Thanks for the opportunity. I think if we look first at the macro, we do see a rapidly increasing awareness and changing attitudes towards mental health. So the good news is mental health is top of mind across many of the people in Asia. We did a survey recently called the Well Economy, and over 70% of the respondents do associate health and mental health together, which is good. That's a big advancement. Now, on the downside, stigma still remains a massive issue. So if you take a country like Hong Kong, the depression in Hong Kong, 25% of the people in Hong Kong suffer from depression at some point in their life, which is 2.5 times the global average. But 74% of them do not seek treatment. One, because it's very difficult to get treatment here. But of the people who did seek treatment, we asked them, how they felt, and 40% felt that they were labelled in some way, in a negative way. So that's the downside. So the good news is people are viewing, there's no health without mental health. I do think companies have a very powerful role to play to make the workplace much more comfortable so people can talk about it. And I can go into more details later in what we're doing about it. But we did set up, initially what we did do is we set up a kind of global mental health task force or committee, of which head in Paris and myself here in Hong Kong, we co-chair that. And we co-opt the 40 most senior people in the company to set the tone from the top, lead by example. So when people look at them, they know it's okay to not be okay. So those are the kind of things that have changed over the last 10 years, and just a little bit of what we're doing at AXA.
And so have you found that having that top leadership has been what's made a significant difference to be able to create that change?
Very much so, because I think it's disingenuous if you don't see the tone at the top. I mean, you take work from home, for example. There's even a stigma attached to work from home. So I from home twice a week to prove to people that it's okay to work from home. I quite enjoy it, actually, because I live near a beach and it's not bad, and I go for walks when I take conference calls. So it's not so bad. But I think that tone at the top is so important. And really, we have a good bunch of guys here, and we've a very diversified workforce and leadership, and setting that tone, and they get it and they lead. I think if you don't have that, then it's very difficult to be genuine and authentic.
Yeah, that's a good point. So I think you've answered this a little bit, but why have you made mental health a priority for AXA?
Well, it's a bit of a personal passion. I've seen how it affects many people, positively and negatively. But I think for me, really getting the right culture in a company is very important. I remember when I was in Korea, I moved down to Korea. We're a life insurance company, and we started a program called Enjoy Life. Not many people enjoy life insurance. We tried to make it a bit more sassy. But we created this people-focused culture. People can say anything to each other as long as you say it with respect. We created, areas so people could be comfortable. And ironically, we ended up, in a poll of university graduates being the company that people wanted to most work for in Korea, which for a life insurance company was, that was the happiest day of my life, that we won that award. So I think creating that culture is very, very important. I think the other thing is, asking and talking and listening. We have things here at AXA we call pulse surveys. So we check the pulse every, I think 3 times a year. And we ask open-ended questions. This is not a box-ticking exercise. Many people do this just to get an ENPS score or whatever. But we ask questions. And we listen to them, we go through them all. Peck is my HR head, we go through them all and we put them into themes because many of them are overlapping. And then we answer all the questions. We talk with everyone and say, well, you said this, we're thinking of doing this, does it make sense? So people feel they're being listened to. And it's kind of ironic at this point in time, in the pandemic, that our pulse score is at an all-time high because we've been communicating. And I think that's one of the things out of this kind of environment. You see so many good things that people want to do for each other and collaborate. So for me, I mean, creating that kind of culture, that can-do culture, is very important.
Yeah, that's really interesting, because I think often when we think about doing things around mental health, we see it as doing something different, but that sense of communication and listening to employees is key, as it is in so many areas of the work. Yeah,
of course we do. Specifically for mental health, we have taken some practices. We have 24/7 hotline. So we did that in the context of shared value. Shared value is taking a societal issue and putting it to the heart of your strategy. So it's not like CSR where you sell 1,000 cigarettes and plant a tree in Brazil. They're unrelated. This is taking something that can make a difference, put it to the center of your strategy, like mental health, and then you can create products to do that. So when you sell employee benefits, whether it's United Nations or wherever, most of the health plans are all about the physical health. Very few cover mental health, and it's not just about paying for a psychiatrist. It's giving preventive advice, etc. So under the shared value Hong Kong, we have kind of collective impact through the 12 companies that started this. Sorry, the 10 companies that started this. We signed a mental health pledge. We were doing all these things together, and learning from each other. This is what's working. This is what's not working. So we had that 24/7 hotline. We converse with their employees and how to be proactive, and all the way from mindfulness, to people who had bad thoughts, etc., and how to cope with it.
So it sounds like you've taken some amazing steps, and I've seen I was going to say a brochure, but it's much more than that, which we'll share with participants about exactly what you've done. So what are some of the steps that you've taken, and what have you seen, and importantly, what's the impact you've seen on that?
So first of all, with this going on at the moment, one of the things we've done is teleconsultation, because it's quite difficult to have face-to-face contact. And we've taken that one step further, and we've used, kind of what we call iconic chatbots to use artificial intelligence, just for, superficial questions, but to direct, to the correct place. We call her Emma, and she's doing a very good job. We love Emma. And we're very fortunate, Kathy, we collaborated. Well, actually, she did everything, and we put the cover on it. But basically, it was really designed for back to work, because people had been off and they'd been stressed, and then we come back to work. It's quite difficult. People don't want to come back, and some people do. So in Hong Kong, the average size of an apartment is about 400 square feet. So those people, a lot of them want to come back, because there's better air conditioning here, etc. And a lot of them don't want to come back. A lot of them are frightened, etc. So they were very, and Kathy can go into the details, of the tips of what not to do and what to do. So it's the 3 Ps of really, protecting, talking about prevention, and then of course the promotion of knowledge and a kind of workplace that can work together. And the one thing we wanted to do, because many multinationals can avail themselves to that, but the companies that were hit hardest in the mental health side were SMEs. So when it's your own business and money's not coming in, it's very difficult. I think the SMEs had it harder, and they don't have any money, they don't have that kind of resource. They don't have, the global HR person in Paris that can call and say, hey, what do I do? So we felt that having that, which was free and downloadable to all the SMEs, hopefully made some kind of difference.
It's a fantastic document, and it's probably a good time to turn to you, Kathy, to hear more about the work that you've been doing, because I know you've been working closely with Gordon, but you've also been doing a lot of work with WHO. So can you give us a bit more of a background about all of the pieces of work you're doing around workplace mental health?
Sure. First, thanks so much for inviting me. It's really a pleasure to be here, and thrilled to be able to work with you around the UN work and the UN agency work. What we're really doing as a general principle across our consultations to a variety of workplaces is taking what we know about mental health, both about the real issues and the real solutions, and trying to work with partners in the workplace to create solutions. And so as a general principle, it's really, really critical. And it's so simple to say, but it is surprising how often it's the case that companies jump over the first step, which is being very clear about defining the problem that they're trying to solve. Because there are many different mental health issues that a company can address, and prioritizing what matters most to your company at this moment in time, or your organization, your agency, is very critical. And then we work with organizations around developing and adapting evidence-based interventions or evidence-informed interventions and measuring the impact. So the second thing that's really critical in all the work we do is a metric about defining success. How will we know if this effort really makes a difference? And the third step then is coaching and working with organizations around making changes organizationally that will enhance related to mental health. We use these 3 Ps that Gordon mentioned as a framework to help us define what we're doing. How do we protect employee mental health? What can companies do to prevent mental ill health and protect employee health? What can companies do to promote positive health, promote positive mental health? So enhance resilience, enhance coping skills, for example. And then third, what are companies doing to provide access to appropriate mental health services when needed? So we've been thrilled to work with AXA on a toolkit specifically designed to support employee mental health during COVID-19 and beyond, and are working with a number of other companies around their specific mental health needs. Be glad to talk further about any of those as we go along.
No, definitely. And I think, I sort of felt it quite good as you were talking, because the mental health strategy, we talk about healthy workplaces, or how can we actually protect and promote and actually make sure our workplace is healthy. We look at how can we make sure we're supporting employees to look after their own mental health, and also making sure we're welcoming and supporting personnel who are experiencing mental health condition, and making sure we've got support available for them. So I was sighing a sigh of relief as you were talking, because I feel like, okay, it sounds like we're working in a way that is in the same way that you're doing. And I'm interested, sorry, just to jump back when you're talking about knowing what to work on and when. So what are the key things do you think needs to be considered if organisations, or you and organisations, or what do I do first? So how do organisations go about making those decisions about prioritising?
So organizations, like Gordon was describing at AXA, many organizations survey employees around their employee experience. It's interesting. It struck me, Gordon, what you said about Korea and AXA being the most desirable place to work, because one of the things that we are seeing, particularly for young professionals, the issues of mental health are a top priority. Mental health and well-being, and how that's being addressed in the company has significant impact on recruitment and retention. So for companies to begin by surveying where are they in terms of their own employee mental health and mental health needs, and what are the gaps in terms of what's being provided, what issues are being addressed, and what employees are saying they really need, what the stressors are. And being very clear about that is very important. It is a misstep to go in with a program without doing a needs assessment, because you could deliver a program for something that's completely not needed, right? And be missing the target, which is where stress. And then I think, as Gordon was describing, the work that AXA is doing that is being led from the top, and with leadership modeling the importance of mental health, a real difference, it requires building a culture that embraces mental health and well-being as part of what a company and community agency organization is going to be all about. And when it then gets integrated in how we go about making decisions, how we go about discussing how resources will be allocated, how work will be distributed, how employee success will be defined. When mental health is part of that discussion, different kinds of decisions are made.
That's very helpful. And it sounds like we need both the leadership and knowing what's happening within the organisation, but also then it sounds like the solutions need to be coming from both sides as well.
That's right.
And
and
Kathy.
When data comes up, when we learn where the stressors are or what the mental health needs are, it's really important to communicate effectively, to demonstrate and in reality hear what people are saying and respond. So this issue that Gordon mentioned around communication is so important, and the really critical need of validating that we hear you and this is what we can do. Companies can't fix all problems, right? But if it's something outside the purview of the company, then providing access to appropriate care is the appropriate step at that point. So making sure that that's what you're doing.
Yeah, that's fantastic. So you've already given us a lot of great examples, and I know that there is a lot of evidence in relation to workplace mental health and wellbeing. So I'm not going to ask you to provide a summary of all of it, and I know you've already given us some good ideas. But what if there was 3 things we were to consider, and you may have already covered them, but when individual UN organisations are thinking about how they might develop a mental health action plan based on the strategy we have, and then implementing it, what are the 3 key things do you think point us towards considering?
So in terms of how to do it, I think the 3 key things are defining your problem carefully, knowing what problem you are trying to solve. The second step is defining success and being sure that you have metrics that carefully assess the impact of the intervention. And the third is being prepared to respond to what you learn, right? And really build a culture that integrates what you learn. In terms of practices that work, there are a wide range of practices, again, depending on what kind of problem you want to solve for. But at the top level, in terms of building culture, I think Gordon said communication, 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 right? So it's very clear that consistent, sustained communication from leadership that both conveys the appreciation for mental health needs of all members of the organization and authentic representation of oneself, one's own experience, and making sure that there's 2-way communication, not only communicating out frequently, but having ways that people can communicate back. It's really critical. In terms of programs, there are very effective models around building peer support and peer-informed, peer-facilitated groups and I think that's a really important strategy in organizations because it empowers employees to engage, it builds community, and it leverages existing resources, right? So there are many different models around how to engage peers to build community and build support for each other. And then in terms of providing access, being very strategic about innovative strategies, leveraging technology and building networks where you are able to get services to your team and to your staff, to your employees. Providing appropriate access is really critical for those individuals who need professional support.
That's great. Thank you, Kathy. And I think it gives us a lot of practical things for us to think about in terms of next steps. So it's great to see, I guess, how that's turned out with the AXA document, and then the steps you took to get there, which gives us a lot of food for thought. So I'm interested, turning back to you, Gordon, how has the issue of the pandemic impacted on mental health in your workplace? Other than the fact everyone's really happy to work at home, I hear. Oh, no wants to go back to the
No,
workplace.
yeah, well, it's very mixed. Well, I think there's no question people are stressed. I mean, in Hong Kong, where I think I said at the very beginning, we've just finished the third wave. So people are getting tired. And there's even talk about, what could be the next fourth wave. So I think that the worst thing is people are leaders who see mental health as kind of like an event, a short-term thing that's happening. Kathy, you used the word sustainable. I mean, this really is a journey and it's not an event. So I feel that, because I've been speaking about mental health for a while, and, maybe a couple of years ago, people thought, what's this guy talking about? Now they're all calling and say, hey, this makes sense. But what I'm worried about is that, it's just because we have the pandemic, and if the pandemic goes away, and if we don't address that, the shadow pandemic could be, global mental health issues. So we really need to focus on that. So I think now is the time to kind of seize the day and really push the agenda for long-term mental health issues, because we have people's attention now and we can get things done. And I think walking the talk is the most important, because when I spoke at the beginning, we spoke about insurance brokers, employees, all that kind of stuff. They want, holistic health, and employers want holistic health, but are they willing to pay for it? It's not free. So they're saying, well, we're already paying this much for our healthcare, do we need to pay extra and whatever? Of course, there's efficient ways you can do things and everything. Insurance isn't the solution. We disrupt by doing other things like health services, like teleconsultations, for example, is very different from what we've done in the past. And we can actually deliver a medication, which we didn't do in the past. We can partner with Uber, etc. So for me, I think the most important thing that we have to do now is seize the day, and have people like Kathy, really, expose her to people who can make a difference. So that's why I think leaders, we can really be advocates, to other leaders, and that's why, I like the concept of shared value, because mental health is a social issue, and if we address that, we can address mental health. It's good for society, it's good for employees, it's good for business because productivity increases, it's good for the bottom line, which is good for shareholders. So it really truly is a win-win situation when governments and private industry, etc., can really get together, and many things that can do that, from climate, etc. But if we talk about mental health, there's so much can be done. And now that's why I'm trying, particularly, in Hong Kong and in Asia and in Japan, we're doing a lot in Indonesia, to really make sure that people understand this is a real issue. We can make a difference, but how do we make a difference? And having that conversation, and just simple things, making the workforce safe, trying to destigmatize. So we have campaigns, it's okay to not be okay. Things like that, we do it globally, and we have leaders in each country who own that, who go to other leaders and make sure we have buy-in and we create that environment. Some countries, works better than others, but for me, that's really the opportunity that we have today to make a difference. And I'm glad that the United Nations is having, this isn't just an event, you're having one, session on Zoom. I know you're having many things, so I doff my hat to you. Well done, Therese.
Thank you. And I think it is a really good point. I sometimes call the current situation a bit of a silver lining, in the sense that it really has pushed the conversation around mental health and well-being. And I think we've all had to start thinking about our own mental health and well-being, and how do we look after ourselves during this difficult time. So it is, I like your comment around seize the day, and I absolutely concur with you on that. I'm really interested when you were talking, and there's slight diversion, but you're talking about all of the different countries you're working in, and obviously the UN works in we work in so many different cultures and countries. interested, do you have a sense of think that things work differently in the different countries you're working in? How much does sort of local culture play a role, or mental health is mental health? Does that make sense?
Well, Kathy's obviously better qualified to answer, but just my simple answer would be mental health is mental health, and it doesn't care if you're from Cameroon or Scotland or Indonesia. But in the context of cultures, you know, and I'm trying to study this now, and I'm just, you know, in low and middle income countries where there's no research, etc. Even in a country like Hong Kong, you know, in Hong Kong, if you go to the public sector to see a psychiatrist, the waiting time is 108 weeks. That's over 2 years. And This is
Wow.
Hong Kong. So, you know, when you have that in Hong Kong, but then stigma takes different faces. You know, we spoke about Korea, you know, Confucius is a heavy influence there, and you can't, you know, so you have to keep it to yourself. And that's, you know, people internalizing that stigma is probably the worst thing possible. You know, if they can talk, because there are so many things that can be done. You know, and Kathy, I wouldn't dare say anything, you know, when you're here. So I think you'd probably be better to hear from here and the things that can be done.
So I'll just add to Gordon's comments. I think Gordon actually is being modest. He knows very well from his work experience, and it very much is supported by the science that, and I'll start with a short story. I was years ago working in a school setting in Cambodia, and schools were limited to half day because of the tremendous political upheaval in the country and the recovery that was occurring in the capacity in terms of educators. So we were involved in an educational program for school-age children to complement what was being offered by the state. And when I spoke to the directors of the school, they were co-directors, one from a high-income country from the US and one from local country from Cambodia. And I said, so what are you doing for the kids' mental health, given all that they've lived through? And now this is, to speak to Gordon's comment about how things have changed, this is almost 15 years ago. And the director from the US said, shh, we don't talk about mental health. And the local director demurred. But at the end of the day, we took a ride down a long winding road that led us to a dirt road that took us to a garden, what looked like a garden shed that had seen better days, that was locked on the outside. And when she opened it, we I saw immediately, there was an older man who turned out to be her uncle, who was very, very impaired with psychotic disorder. And she said, we need to talk about mental health, and we need to talk about it now. So I think one of the things that we are overcoming, fortunately, is the arrogance of thinking that as a high income country, that mental health, that people in other places, you know, aren't worried about mental health or don't want to talk about mental health. Mental health issues are real in low, middle, and high income contexts. And what we see that's most different, and suffering is suffering, and mental illness that's not treated causes a lot of suffering for the individual and those around that person. And what we see as differences are cultural differences around understanding why someone is not well, and cultural differences in how we go about addressing those concerns. And being sensitive to the different cultural understandings and different cultural strategies will be key to success, which is why any of these efforts need to have a meeting of the minds where you have leadership and you also have people who are very close to the ground who are part of telling the story of how we move forward together.
That's a fantastic story, Kathy, and it really shows that we can also make assumptions around mental health and having the conversation, but it is so important that so what I'm taking from that is we need to consider, the local, the country and what the issues are, but also not shy away from talking about mental health, and remember that stigma plays a role.
That's right. And actually, I have examples like that over and over again. And just as a comment around the toolkit that we worked on with AXA, one of the significant issues that has enormous reverberation through a community is when we lose someone by suicide. And there's a lot of discussion during this pandemic about increased risk of suicide. In fact, in many places that's not happening, but there is a concern, and there are ways that we can prepare, and there are ways that companies and organizations can try to reduce risk. But that's a pretty heavy topic, right, to put into the toolkit. And I have to say, I wasn't sure when I went back to the AXA team whether AXA was ready to take it on. And they said, listen, this is real and we've got to have it in there. It's got to be in the conversation. And I think more organizations and more leaders who can bring it into the conversation and understand that by talking about it, we don't cause it. We actually just bring relief, because it's the elephant in the room if we don't speak about it.
Yeah. I think it is a really good point. I think we've just started the conversation around suicide prevention and what can we be doing. So I think it's a really good point that you can't have a mental health strategy without considering the issue around suicide.
Mm-hmm. Yeah.
So that's been really interesting. I think there's some really good food for thought for us around that. Gordon, coming back to you, you've talked about the role of organisational leaders, but I'm interested in really specifically about organisational leaders to be the agents of positive change. So if we were to be talking to our leaders in the organisation, what advice or steps would you recommend they give to better support mental health in the workplace?
So first of all, need to talk about it. We need to make sure it's a real issue, that people are aware of it, that people understand that mental health is just part of everyday life, and it is an issue, and there's no point in hiding it. As Kathy said, we need to talk about it, and you need to have that environment, whether it's one-on-one, or whether it's peer-to-peer, or whether it's a telephone line. I mean, one of the things is, with particularly with introverted people, that's where we use technology. That's why we're looking at Emma, and how could people feel more comfortable to talk to a chatbot than talk to a real person. Of course, that's just very superficial and more concierge and can direct, etc. But I think that knowing that it's comfortable, it's okay to be not okay, is very, very important. So that environment and walking the talk, and not just as I say, making it an event. Really being authentic about it, because it's good for business. It's the right thing to do. So don't be shy about it. You may not know anything about it, because I didn't know much about mental health, and I still don't, but I know maybe a bit more than the average person, and I'm trying to learn. So I think if you're authentic, and mental health it's not that it happens to a small minority of people. I mean, I just told you in Hong Kong, 25% of the people have depression at some point in their life, and more than once. So this is real. This is a real issue. The second thing is there are, so in AXA, we're developing products, because if you look at insurance in the United States, where you are, I think 40% of all life and health insurance is sold through employee benefit schemes, rather than individual. So if you can really provide that service, it doesn't have to be insurance, but that hotline, hey, even mindfulness meditation, that's something I've tried to do. I'm not very good at it, but I've tried to do it, and I've worked out my own little way to do it. But by having those kind of things, people can go to that in their own space, in their own time, designed, because it's very personal. I mean, I think mental health is a very personal issue, particularly the recovery to mental health. So I think it's being authentic. I think it's being confident to talk about it, and it's making people comfortable. This is the situation we have today. This is the way mental health is, and it's okay. So for me, I think, just in very simple terms, that's how leaders can do it, and be advocates, and talk to other leaders, and build up, that change. So it's just the way we do things. Unfortunately, it's not the way we do things at the moment, but hopefully it will be in the future with people like yourself, Therese.
And obviously amazing advocates like the two of you are making such a I think the more the leaders can talk about it, the more other leaders are more likely to talk about it as well.
Mm-hmm.
Yeah, I think so. We actually had a mental health day, the Global Mental Health Day. I think it's October the 10th. So one of the things we're doing globally, and particularly in Asia, we're going to talk about it with different people. And we make the most of the assets that we have. So we sponsor a football team. You guys call it soccer, Liverpool Football Club. So the captain of that soccer team, and they're pretty good, the champions of Europe, and or they were last year.
You're not
and
they, Gordon.
But the captain, Jordan Henderson. I get one of the, so I open it up, and one of the guys in our office who's the biggest Liverpool fan, he actually interviews him. And the topic is mental health and resilience. So, when we're showing this to our employees, our employees see, Roger, who's our guy. They all know Roger because he works in AXA in Asia, and he's talking to Jordan Henderson, and they're talking about, resilience and mental health. It's almost like kind of cool that people like that, and he's very interesting. He talks about, when he has issues, what he likes to do is talk to someone he doesn't know. He feels so much comfortable talking to someone he doesn't know than his best friend. So that's just his personal technique.
Yeah. Hearing that story, Therese, one of the things that occurs to me that's so important about the role of leadership and the role of companies like AXA and partnerships of this sort is the message that that mental illness and not feeling well in terms of our mental health is a very common thing. Like Gordon said, we estimate 1 in 4 people, right, will have a mental health condition. But the message that there are things we can do, and there are treatments that work, and there are programmatic efforts that make a difference, creates an enormously empowered experience and a sense of agency and resilience, as Gordon's describing, and ultimately builds individual strength and community strength. So I think that's a really important piece of the story that's evolving in these partnerships.
Absolutely. And it's really interesting to watch the two of you work together and see how that can make such a difference, and how important it is to have people in organisations creating those change, and then the experts sitting behind it, making sure we're looking at everything that's been learned and how can we putting that into action.
Mm-hmm.
Now I'm mindful of time, and I feel like I want to hog all the questions, and I've got a couple more for each of you. So I'm just going to ask one more. Gordon, I know that a lot of it's in your document, but I'm interested in just for our HR professionals in terms of the policies that become really important around mental health. What do you think are the absolutely key things we need to think about from a policy perspective?
Well, first, I think you need to go to the employee benefit plan. And you need to, I think it's a leadership issue rather than an HR issue, first of all.
Yeah.
But I think as an HR professional, you have to go to your employee benefits plan so you can have those services to do that. I think that really is probably the one thing you can do. Secondly, you know, having an inclusive, diversified, inclusive workplace, I think, you know, through meritocracy, of course, makes so much sense. You know, by having that, and you know, just creating that engagement, and making people feel that they're listened to, and even though it's themes that might not be addressing specific questions, because most of the issues are pretty similar, that you get back to them and you say, hey, listen, we understand. Because when you spoke about people wanting to work from home and people wanting to work from the office, it's actually quite barbell. We ask people. So some people want to work from home all of the time, and some people want to work in the office all of the time. And most people, I can't remember the final number, but the majority of people wanted to work roughly about 3 to 3.5 days in the office and want to take Fridays off. You know,
Yeah.
It's not that. It's you know, people. I mean, I find when I work from home, I actually work a lot harder. I'm more productive, maybe not harder, but I'm much more productive than I am in the office. So I think it's listening, because some people, you know, and particularly women have been affected by COVID, I think, more than men. I mean, 70% of the healthcare workers are female. We did a survey at AXA, and we found the mental load, which Kathy can define better than me, but increased 10% over the last 6 months. You know, so people, you know, females are really feeling the stress of juggling everything. And how can we help certain people a certain way and other people another way? And that's by listening. And a lot of that is by having a good HR team. And by doing that, normally, you know, the engagement levels are higher, and higher engaged workforces usually produce better results. So again, it's good for business. So it's not, you know, some people say to me, oh, you talk about mental health and whatever, you're a big softie. You know, that's a Glaswegian term. You're a big softie and whatever, and why do you talk? But, you know, it's good for business as well. You know, we're doing it for the right reasons, but it truly does improve the productivity if you do it the right way. So I think having an authentic, empathetic HR and leadership team that really listen. We can't solve everything. I mean, some people want things that are just not possible. But of course, we can do our best. And I think if people understand you're doing your best, I mean, we get so much positive. You know, we gave people masks when they were quite difficult to get. And I've never had so many thank you letters or emails, you know, in my life from employees. Hey, thank you for those, like, you know, 30 masks that you gave us. And then we carried on, and we still do it today because now masks are much easier to get. But at the beginning, they weren't. So just something very small that, you know, costs nothing makes such a massive, disproportionate difference.
That's fantastic advice. And I feel like I'm going to give, I realise we've got about 10 minutes left. So if people have got questions, if you want to start popping them into the chat box, and I'm going to, that sounds like a good final piece of advice from you at the moment, Gordon, and you've given us lots of ideas to go with. Kathy, what is the final piece of advice, or the one thing you would say to the UN at the moment about what we should do, what we should consider?
So I would say that to listen to Gordon, and then to for the UN and UN agencies to build a network of leaders who care about these issues, so that you're not reinventing the wheel, because there's an enormous amount of evidence. There is good practice that you can learn from, and that when there's a network of leaders who are leading the charge, the total is greater than the sum of the individual parts, right? And so it really builds in terms of creativity, in terms of effectiveness, in terms of being able to share resources and leverage learning. So I would say create a leadership network and collect data. Make sure you know that what problem you're trying to solve, how you're going to measure it, so that you have some real means for knowing whether you're on track and whether the resources are being expended in a way that is most effective.
Fantastic advice, Kathy. I'm writing that one down.
Therese, I think you might have frozen.
I think Gordon and I are both still
Yes.
going here. So maybe what we can do, Gordon, is just share a little bit more. Oh, there we go. There's Therese. You're
I was
back.
just
There for a sec.
the challenge of Theresa's mental health at the moment is my internet keeps freezing. So if I freeze again, one of my colleagues can jump in and facilitate questions. But
Therese, can I just interrupt for a sec there? That
You
reality for you today, with so many people working from home, Gordon's comment about the masks, our work organizationally around ensuring that people have chairs and internet, desk chairs and workspaces and internet service makes a huge difference. So sometimes mental health needs are met by programs and interventions that aren't specifically quote unquote mental health interventions, but make a huge difference.
Absolutely. And I do think we break these things up, but little things can make a big difference. And my internet has been fine all these months, and then just last week it's gone. Now I'm seeing a question around breaking down hierarchies, which are entrenched. So how do you work with the power imbalances that can make it difficult, particularly for women, to come forth about their mental health?
Well, I think you, first of all, as a leader, you need to walk the talk. Everyone needs to see that you are doing it, and the people, and of course we have leaders in our organization who sometimes don't get it, but I think they do get it when they see that the leader is walking the talk and he believes in it and it makes sense, and you just need, sometimes you need specific actions, our templates which become behavior, which become the culture, and if someone really genuinely doesn't get it and is a cultural misfit, then they should not be in the company, because that's not the company we're trying to create. But Kathy's very pragmatic. How do you get around that? So if you have a boss who just doesn't get it, is there someone in HR? Well, sometimes people don't trust HR as well. So that's why this 24/7 hotline, which is not just about mental health issues, and that's where even artificial intelligence, hey, my boss is really tough, I can't sleep, and then Emma could actually give you advice on well, the 3 best ways to sleep are counting sheep or whatever they are, I don't know. So it could be something very at that level, but really having a place that's outside of the hierarchy that you can talk to, them who can coach you, but also to have a safe place within the company as well, where you can go. You won't be judged. It can be anonymous if need be, and you can sit down and you can chat. But hopefully that's more of a last resort or secondary issue. But for me, that's very important, that if you don't get that culture and if you don't show people this is the way we are, in those behaviors, then the culture, you're not culturally consistent. So if you're culturally inconsistent, then that's the worst thing in the world. And we don't always get it right, but I think if people see that we're really trying to get it right, then you get more credibility for that, because sometimes obviously we do get it wrong. In terms of women, I think in my own company, there have been women who have younger children who really just can't be at the office, late at night and whatever. And they have bosses who, maybe don't get that. So we just have to show this is what we are as a company. This is what makes sense. This is how we get results. And we manage by objectives. and outcomes, not by where are you at 3:10 in the afternoon. So if you don't have that trust, you don't really have anything. So it's very difficult to achieve, but I've tried to articulate, what the culture would be in that situation.
And that's really useful. Sorry, Kathy, go.
I was going to say, it is absolutely the case that the mental health impact, that in general, women present for treatment more readily than men. And so we don't know whether women really have more mental health concerns or are just more willing to talk about them. But we know that's true. We know that the pandemic has had a differential impact on women, with women feeling much more intense role conflict and more increased burden around childcare and around caring for older parents. And we know that around the world, there are a wide range of norms around hierarchies and gender. So I think taking into account all of those realities, creating space, as Gordon said, within an organization that enables women to be heard and be supported, and where there's a culture that says that we aim to achieve greater equality and equity across all employees, for men and women, that goes a very long way in terms of beginning to make change. Being prepared that if you're in a country or in a culture, in a company or in a culture that's still highly gendered and where the hierarchy is great, it's important to find some allies as you try to do that work.
And it's from that, I mean, we have a gender parity strategy, so it'll be interesting for us to make sure that we're including that as part of the work we're doing. Yes. I'm going to just very quickly, one last question, because we've only got a couple of minutes left, which is the question around how do we move forward together? And so what advice would you give people within organisations so that they could start the conversation with their leaders, so that they can move towards developing a mental health strategy within their organisation? So how do people actually influence their leaders to do this?
Well, I can tell you quickly what we did was establish this task force at AXA, and it's a global task force. And we have a number of people from around the world. It's interesting. I just realised that I'm the only man on the task force, because I do think female leaders perhaps are less shy in talking about mental health than men. And I think maybe also the men weren't asked, because we have a great bunch of guys, leaders here who are men. But I think having that and really talk about, well, what do you think? Could this work? Could that work? That's why we started, global programs. And global programs are good as like a concept, but then it has to be the CEO of the country. He or she has to take that and localize it so it's real. So for me, we started a global task force, which of course means you have then task force in regions and countries and departments. And I think cross-functional is very important as well. And that helps you get, Kathy spoke about allies. So by doing that, by having a task force in a country of someone who's in sales, someone who's in accounting or whatever, and they become allies, and you can, really make a difference together. So that's how we started at AXA. So Kathy, I'm sure you have much better ideas, but that's what we did.
Yeah. That's absolutely, totally support and agree with Gordon. And I would say, to be very practical and concrete, the journey starts with the first step. So if everyone on this webinar today sent out a communication to employees, sent out a message on LinkedIn, put a post on their social media to say, I attended this meeting, I attended this webinar because it matters. And these are issues that we care about, that I care about, and more to come. That would be a great first step.
Wow, that is a perfect call to action, and I think a perfect way to sum up this meeting. So we do take the call to everybody on this call. What is one thing you can do? How can you put the message out there that this is important? We can all play a role in this. So we do ask, go think about how you can move forward in terms of the next step. And even if it's as simple as saying, I've learnt. Also, we will be sharing the details on our new Twitter and Instagram account. So go on there, like that, share the content, because I think Danielle has written some really good quotes from the session today. I cannot thank you both enough. I just want to keep talking to you both, but I realise you probably want to go to bed, Gordon and Kathy. You've probably got multiple things to do. But I really like. Thank you for giving us the time. Thank you for giving us your amazing wisdom and insights. And I think there are so many things that we can go away and start to think about how do we institute this both across the whole UN system, within the different UN organisations, and also at a local level, because we can all make a difference. So thank you so much. It's so appreciated. And I do hope we get to continue the conversation with you both.
Thank you. And thanks for all your...
Thank you, Therese.
Thank you. And if people there, if you'd like to turn your cameras on or unmute and give a wave, just so we see we're not just talking to names, you're absolutely welcome.
Very good. Thank you.
Thank you. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you, everyone.
Thank you. Thank you very much. Thanks a lot.
Cheers, guys.
Thank you so much, Gordon. That was fantastic.